If you think electric scooters zipping around your town or city are simply a fun, fast, and cheap form of transportation, this podcast will be a wake-up call.
Well, a man has died after a crash involving an e-scooter on the Bloor Viaduct last night.
A 21-year-old man died in hospital Monday after the e-scooter he was riding collided with an SUV.
The man later succumbed to his injuries. Roads reopened in the area just before midnight, and there's still no word on charges.
Doctors and families are speaking out about the dangers, the mounting fractures and head injuries that are sending people on e-scooters to hospital. Some don't survive. 25-year-old Austin Walker of Saskatoon was hit and killed while on an electric scooter. This is his father, Chet.
I want people to be aware like how dangerous these are. It's about getting some sort of safety regulations in place or whatever we have to do to make these things safer.
Data from the Canadian Institute for Health Information is showing a 22% increase in hospitalizations from e-scooter injuries across Canada. You'll hear from emergency physician Brian Rowe, who's combing the medical files in Edmonton to document a sharp rise in injuries there.
About 17% of our cases involved head injury. And if you have a significant head injury, you could be disabled for life.
Children are also riding on these powerful devices, sometimes as passengers, and are getting their faces smashed and their young brains damaged. And 80% of them are not wearing helmets, according to Dr. Daniel Rosenfield, a pediatric emergency specialist with Toronto's Sick Kids Hospital.
I've been trying to get parents to understand these aren't toys. These things can get to wicked speeds wicked quickly. I would say children under 16 should not be on them.
Welcome to the Canadian Health Information Podcast. I'm Avis Favaro, the host, and this conversation is about the skyrocketing use of electric scooters. Up against potholes, pedestrians, and cars, the rider often comes out the loser.
He was an amazing kid. Just wasn't fair.
That is Chet Walker. His son, Austin, died last year after riding an electric scooter to get home in Saskatoon. But he was killed by a driver who had been drinking, and there is no protection from the force of impact on these e-scooters. Austin's father wants to warn Canadians.
It was a rental. They were out watching playoff hockey last year, and 4 of them left the place where they were watching. 2 went one way, headed home. The other ones went the other way, heading home, and our son was heading home.
At what time, roughly, was it?
Around 3 a.m. was reported. So,
and was there helmets provided with this rental?
I don't know. The ones I see around the city, you might see a couple with a helmet, but the majority of I see just they don't have helmets on there. They're just everywhere. It's just something has to be done.
And so he was driving, and an impaired driver hit him.
Yes, left him there to die.
And so it was a hit and run.
Yes.
That's terrible. Did you think prior to this that the scooters were so risky?
I didn't, to be honest. I just thought there were some regulations in place. I didn't know that they were allowed on major thoroughways or with speed limits that exceed these things. I just thought there's some regulations. I'm not sure about other centers around Canada, but as far as my knowledge, Saskatoon and the 2 scooter companies have nothing in place.
Why do you want to share this story?
Because we just, hopefully we can help, make a change so this doesn't happen to anybody else.
What would you like to see? What's your wish?
My main wish would be to shut them down at dusk. Don't allow them in the dark. Just kind of keep them to one area, not where you can ride them to everywhere in the city. Like I've seen them on the side of the road on freeways. They're just everywhere. Since this happened, I know his younger brother, they used to use them too. Now they won't go near them.
They won't go near them.
Nope.
If you had to put message to people listening about the dangers of e-scooters, what would you, given what you've been through, what would your message be?
Make sure you know what you're doing, because they're extremely dangerous. And after this happened, I'm more aware, and I watch and I see around the city, and yeah, it's not good. They're very, very unsafe.
2 Canadian emergency doctors have started documenting the growing toll from electric scooters, and the data is worrisome. Joining us now from Edmonton, Dr. Brian Rowe, Professor of Emergency Medicine at the University of Alberta. Welcome.
Thank you. Good to be here.
And from Toronto's Hospital for Sick Children and Professor of Pediatric Emergency Medicine, Dr. Daniel Rosenfield. Welcome.
Hi, glad to be here.
So this morning on my walk down the street, this happened. I'm going through and suddenly whoosh, zips across a young man, I'd say maybe 15, 16, on a scooter. And I thought to myself, before I prepared for this podcast, I would have thought, oh, cool. Young guy, cost-effective, transportation, environmentally friendly. And since doing the preparation for all of this, I had a completely different view on it. No helmet, too fast. And I thought, I'm worried for him. And I think that moment of education made me understand why you both said yes so quickly to being on this podcast. It's the power of teaching people what you see and a different look at e-scooters.
Absolutely. We recognize that people need to have an efficient and effective way of getting around urban environments, but these e-scooters are not benign. We've had rental e-scooters in Edmonton since 2019. So we're 6 seasons into it, and we're seeing a huge increase in the use of these e-scooters. We've definitely seen increases in injuries and injury severity.
And so, Daniel, you're seeing the same sort of trend with children and teens in the Toronto area.
Yeah, and I think the explosion in popularity is really what's driving even why we're having this discussion. So we've been tracking data in the pediatric context for basically since it came out in the last 5 years. We saw 1 injury at sick kids in 2020. In 2024, we saw 46. And just in the month of May 2025, we saw 16, which is more than the preceding Mays all combined. So we know that this is becoming more popular for the reasons you mentioned. It's, this isn't to paint this with a broad stroke and say they're all bad and should be banned exclusively, but they are a risky mode of transportation for children in particular.
Explain risky.
We know that kids can't ride these things. They're very powerful. They can go very quickly. And the center of balance on them is very askew. I don't know if any of you have ever ridden one, but they're actually quite hard to get on and to ride competently. And kids and teens just don't have that kind of body wherewithal just yet, which makes it additionally risky.
So, Brian, you recently published a study about what you are seeing in hospitals across Edmonton. So what exactly did you find about injuries and helmet use?
What we've been seeing is increasing severity of injury, more frequent injuries, and concerns over head injuries. Specifically, about 17% of our cases involved head injury, and we know that helmet use on these devices is exceedingly low. We have a helmet legislation in Alberta. Every province has some sort of legislation, and it's not being applied to e-scooters, and the use of helmets is very low, maybe 1 or 2% in the rental market. Even if a rental device has an attached helmet as part of the rental, only 10% of people are using those. And if you have a significant head injury, you could be disabled for life. And these are largely young people, and they don't really understand the risks.
Do you remember the most severe case when you realized you had to start speaking out about this?
I can give you one. I was working a late evening, and a patient came in by ambulance from a crash scene, and he was accompanied by his friend who was e-scootering with him. and they were riding along, and he hit a pothole. And I don't know if you've ever driven in Edmonton, but we are the world's capital of potholes. And he got launched off his e-scooter, riding at about 15 to 20 kilometers an hour down a slight incline, and he landed on the cement. And so he had a head and neck injury. And his friend came up to us and said, "Doc, I'm not going to lie, we've been drinking." And I said, "I'm not going to lie, I know that." Because emergency physicians, if nothing else, can spot people who've been drinking because we see it all the time. And this was slurred speech. Was that slurred speech because he'd hit his head or because he was intoxicated? And was he intoxicated with alcohol, or was it other combination drugs like cannabis or opioids? So very complicated case. We did CT scans of his head, his neck, chest, and abdomen. This is like the whole body. And it took hours to identify the injuries and decide on management. So these cases are complicated. They're potentially very serious, and they consume a lot of resources.
So are these injuries mostly happening in first-time novice riders or in people who ride the e-scooters regularly?
We don't know the role of inexperience. Daniel, I don't know if Sick Kids does interviews on the people that get injured, but we don't get that opportunity. So we don't know if it's expert riders or inexperienced. But my own anecdotal evidence is that people just don't have experience with that kind of power. And the private e-scooters, the ones that are personally owned, they go much faster than the rentals. The rentals have a gauge on them. They can't go over a certain kilometer per hour speed, but the private ones pass you on the road in your car. So these are like motorcycles, quite frankly.
Yeah. And again, in Toronto, they're actually illegal, so we don't see the program ones. But the Ontario legislation across the province says they all have to be maxed at 24 kilometers an hour. And we absolutely know that's objectively not the case. If you just go on Google and buy e-scooter, they'll proudly advertise that they go to 40 to 50 kilometers an hour with nothing kind of standing in that way. Some of the companies who are more responsible put a speed limiter, but those can be easily jailbroken by going on ChatGPT and asking, how do I jailbreak an e-scooter speed limiter?
Oh dear, really?
Yeah. So yeah, you can just go on YouTube and figure out it's a simple software hack.
So are the injuries different between the pediatric patients, Daniel, and the adults?
So in pediatrics, I say kids aren't little adults, but in trauma, the same feeling, same kind of goes. However, head injuries are still the dominant kind of worrisome one. So proportionally, kids' heads are bigger than adults compared to the rest of their body. So they're even at higher risk of head injuries. Our helmet data is basically the same as Brian's, which is very poor. I think some of the data that we have, 80% of people were not wearing helmets. And the kid, like we're talking about, the average age of our injuries was between 10 and 12. 90% were boys, which is unsurprising. But again, I would venture a guess to say that most kids don't have a ton of experience riding because they're children.
So you're seeing kids around 10. That makes sense because they're exploring the world and they want to go fast. But are there younger children that are being harmed by e-scooter use?
We've seen a bimodal, so two spikes of injuries. There's a spike at the main one at age 10 to 12, and then there's also one in the 4 to 6 range. And those aren't kids who are scooting themselves. Those are passengers. And I can't harp enough on passengers and e-scooters are a bad combination in both kids and adults. And Brian can speak to adults, but when you see the little kid riding with their parent, I will tell you that these scooters are not designed for passengers. It totally throws off their weighting. And it makes it a much, much, much higher risk to crash, irrespective of engaging in it with traffic and other things like that.
I've never seen that. You're saying that the parents put the child on the scooter in front of them or behind them?
Yeah, they either go behind or in front, kind of like sometimes they're hugged, sometimes they're holding the post, which of course, if you look, a 6-year-old their face is right at the level of the post. So if they crash, they get what we call facial smash injury, which can absolutely be devastating and severe if it occurs at speed, which again, these devices can get to very quickly.
Brian, do you want to add anything?
We did observations last summer and this summer, and about 5% of all of the devices that we saw had passengers. And it's children and it's women. So sometimes an adult woman holds on to their partner from behind, but most of the time they're functioning as an airbag, right? They're in front of the partner. Same with the child. So if there's a crash, the person behind is going to be buffered by the person in front. So it's really a huge problem, and it's unrecognized. We don't even have data on passenger injuries, and we don't have data on pedestrian injuries. So, for example, I had an elderly professor who I was meeting for lunch, and I was walking down the sidewalk, and she was putting money in her parking meter, and an e-scooter went behind her at a speed. If she had taken one micro step backwards, he would have knocked her out. So again, we don't collect that information. They're called pedestrians. We don't have systems in place to accurately collect that information, but it happens for sure.
One of the reasons that we're doing this episode is because data from CIHI has found a 22% increase in the number of e-scooter injuries that are leading to people ending up in hospital. But so I understand that there are other gaps in data collection to be able to actually show what's exactly happening, because these scooters are so new and they're not always noted in the medical files. Daniel?
So, we were used to be in a complete vacuum of data where you would know what happened when you talked to them, but that didn't get documented in the chart. It didn't get coded. It didn't get all the way up to CIHI. Now people are writing it in the electronic medical record. The electronic medical record is reviewed by either a computer or a person or both. And we're able to actually pull out that data. So we are able to get a little bit of a better picture. The vast majority of our collisions are falls from the scooter themselves. So about 3/4. But almost a quarter, actually, collisions are with a vehicle, and about 8 to 10% were kids struck by scooters, by people on scooters. And we actually have that level of granularity because our surveillance system actually gets a little bit of what we call a narrative around what happened. So people are now documenting in their notes e-scooters much more diligently than they used to.
I would say that our study that was just published on machine learning to search through the nursing notes to identify e-scooters. And then we had to go and do chart reviews on over 1,000 cases to find the 750 that we included, because some of them weren't e-scooters that were recreational. Some of them were other kinds of active transportation devices. So the code now exists. I don't know how accurate it is, but they have adopted a code. And so it's much easier for me to report that the increases in severity and frequency in the Edmonton zone are exponentially increasing because that code now exists. So that is an emerging area where we can do some research to validate the work.
At the top of the podcast, we spoke to Chet Walker, the father of a young man in Saskatoon who was killed while on an e-scooter. But I've discovered it's really hard to find stats on how many Canadians have died. Do we know nationally how many people or how many deaths have been linked to e-scooters?
Not that I'm aware of, Daniel. I mean, again, that kind of data is housed in multiple areas. So if you came to the emerge and you died in the emerge, that would be recorded. But the large bulk of these injuries are death at the scene, and those are not collected in the same registration databases.
From the kid angle, usually a child death in this space would make media attention. So we know, I think we can be pretty confident to say we thankfully have not seen any pediatric deaths, at least in Ontario. I can't speak nationally, but all the stuff that I've seen is I don't think we've seen any nationally yet. And I say yet because, when you have these numbers that are increasing at the rate they're going, it does feel a little bit inevitable, unfortunately.
Do helmets save people from serious injuries?
I think there's robust evidence to indicate that helmets prevent serious face and head injuries. If you get run over by a truck, the helmet's probably not going to help you. But if it's infrequent. What more commonly happens is you get launched off these things, and you as you're landing, even if you don't hit your head directly, the momentum is going to cause your head to be injured. So those kinds of injuries, if you have a helmet, that's going to prevent a lot of injuries to the brain. And we've seen this time and time again with bicycles. The helmet is cracked in half. It's actually split in half, and the person walks out. Another person who slips on some gravel, doing tricks, not even going fast, hits their head, no helmet. They're admitted to hospital. They need a blood clot evacuated from their head. A helmet would have completely eliminated that risk. So helmets work. There's no question of that.
And where I do think I'd be curious about some potential future research would be the actual type of helmet. So I don't know if you've looked around, but I definitely see people wearing everything from like little bicycle helmets to full motorcycle with visors and jaw protection. And these are people who I've seen typically going much faster. So there's probably some tacit acknowledgement among people who do wear helmets that e-scooters probably present a different risk profile. Again, because of the speed that they can get to and the speed at which they can achieve that speed. So again, unlike a bicycle, the Tour de France riders need 5, 10, 15 seconds to get to 30 kilometers an hour. These scooters can do it in a fraction of a second because they've got so much torque from these electric motors, much like the electric cars are just so much quicker than gas-powered cars because of the way these motors work. And that's where, a lot of the education I've been trying to do to get parents to understand these aren't toys. These things can get to wicked speeds wicked quickly.
You bring up an interesting point. I thought about it when you mentioned that the parents who put their kids on the scooter end up in Emerge. How do they feel when you have to tell them this injury to their child could have been prevented? What were you thinking?
To me, the whole reason we're having this discussion is because this is so new, right? I'm so steeped in this, so it's very easy for me to say, well, I can't believe you didn't know that. But that's not remotely fair to parents today. There's so much to know. There's so many risks out there for kids and teens. But there's good data to talk about using the emergency department visit as kind of a sentinel event and to have the discussion around injury prevention for future sake. And we have to balance that, of course, with we want, again, scooter context aside, we do want kids to be outside. We do want them to be taking healthy risks, but it has to be, we call it risky, not hazardous play.
Based on what you've seen, what should provinces, municipalities do in order to protect both children and adults? I know that some provinces like Quebec, they have a minimum age of 14 and the helmets are mandatory. And in Ontario, helmets are required for those under 18, but not those over 18. Is there anybody doing it right, Daniel?
So, it's hard. I'm always careful about these questions right now, because right now we're very early in this, I'll call this discovery process of learning about what the injuries are, who they're happening to, and what the context they're happening in. I usually stay away from discrete policies. I will say children under 16 should not be on e-scooters.
Period. No scooters 16 and under.
Yeah, period, full stop. But that's the answer for me for the pediatric context. In the adults, I'm going to defer to Brian, but I think it's a little bit more nuanced.
Brian, nuanced? Because if you're seeing an increase, it would seem it may be early and you want more data, but you also want to save lives and prevent people from ending up in hospital for extended stays with head injuries. So why not err on the side of caution?
I think that, as they say, the horse is out of the barn. E-scooters are here. And in fact, private personal e-scooters are banned in Edmonton. Banned. But, we see a large number of e-scooters that are you can tell they're personally owned because they're not lime green, orange, or black and blue. Those are the three rental companies. The private ones are very clearly private. They look different. They are faster. So they're available for purchase and rental. I don't think we've talked to the city planners. There's no discussion about restricting e-scooter rentals in the city or the surrounding municipalities. So what we have to do is we have to do a better job of educating.
And to that point, Brian, what exactly is the education that people need? What is it that you want to tell the public about how to use these e-scooters safely?
The way I look at it is alcohol and cannabis don't mix with driving. They certainly don't mix with motorcycles. They shouldn't be used while e-scootering. A helmet is a good strategy for injury prevention, and people should use these things away from motorized vehicles. Falling off of an e-scooter could be traumatic, but being hit by a truck or a car and being on an e-scooter, that could kill you.
You mentioned the private companies. There's one lawsuit in Saskatchewan that is pointing the finger at one rental company saying you need to do more to protect people when they rent these devices. Do you agree?
Yeah, there have been a couple of interesting interventions. For example, after I think 9 o'clock, several of the e-scooter companies have required the answers to 3 skill testing questions. So if you fail those questions, your Visa card is blocked. So you can't rent a scooter. Now, you could get around that, but in the pilot study, there were a significant proportion of people after 9 who failed that test. So again, if we're working together, injury prevention, emergency departments, healthcare system, and the rental companies, that would be a possible solution for evening travel, right? I mean, that to me makes a lot of sense.
And do more of the injuries happen at night?
Yeah, fewer people are e-scootering at night than during the daytime, but the large majority of those injuries at night have alcohol and cannabis on board.
Okay, a couple more questions. Do you support the creation of a national database that would track e-scooter accidents and injuries because this is so new and the effects so serious?
I certainly support the addition of e-scooters to all existing injury prevention databases, surveillance networks, etc. And should be explicitly looked at, especially given what we're seeing. I think this is a very hot topic issue right now. And I think it will be for the foreseeable future. I'll be curious what the next 5 years look like, given what happened. This was not on the radar 5 years ago.
How soon do you want this integrated into the existing data collection system?
I mean, yesterday. It's a problem now.
So, Daniel, you have been working on patient safety for a long time. We first met when you did a study on tiny magnets that children were finding and eating them, and these magnets were collecting in their digestive tract, which is, dangerous. But because of that data you collected, it played a role in getting these magnets banned in Canada. So here we are with these scooters. Where does the threat of these scooters rank for you at this moment?
I think the short answer, the cop-out answer is I'm not sure yet. It's still early right now. Just notice that, to me, using the magnet analogy is we started noticing cases when we first talked in 2013, but they had been slowly increasing since 2011 and then didn't peak until kind of 2015, 2016. So I think this is a question I can only answer probably 5 or 10 years from now, when we actually see how this all plays out. If these continue to be, as the climate becomes warmer and these are used more parts of the year in more cities, this may just continue and the technology becomes cheaper, this may just continue to get, I'll call it worse, over the preceding years. However, if municipalities and policymakers look at this and are able to figure out a policy solution or mitigation technique, maybe it'll tamp down. I'm not sure yet. I think time will tell.
And Brian, you are waving the red flag because you are also seeing what Daniel does.
Yeah, the point to be made is that injuries are not accidents, and that there are ways that these can be predicted. So In Daniel's case with the button batteries, they studied it, they brought it to policymakers, they made changes, and they changed people's outcomes. In bicycle injuries, in snowmobile injuries, in sledding injuries, those we have studied over many years, and we have been able to identify the causes and implement strategies that reduce the frequency and severity of the injuries. There are examples across the board where this work results in improved outcomes for patients and better health for the community. So I think that's another point to really emphasize, that this is important work because it leads to change.
All right, I want to thank you both. It's been a learning experience for me, and thank you for your research.
Thanks for interviewing us, David.
No problem. Thanks for having us.
A note, Transport Canada is currently reviewing all e-powered bikes and scooters, with a report expected out later this year. In the meantime, you may want to heed our guest's advice. No electric scooters for kids under 16 and adults only while wearing a helmet. Thank you so much for listening in, and you can find out a lot more about the good work of the Canadian Institute for Health Information and its latest reports on healthcare measures on the website at CIHI.ca. And please subscribe to our podcast on your favorite player. I'm Avis Favaro. Thank you so much for joining us, and talk to you next time. And please stay tuned for news on an important webinar coming up with my colleague, Kevin O'Keefe.
Hi, I'm Kevin O'Keefe, host of CIHI's new webinar series, Beyond the Numbers. Did you know that Canada has some of the richest health data in the world? But every year, we leave almost $10 billion on the table because of missed opportunities to use our data better. Want to know how to cash in? You can register for our live webinar, Wealth of Information, Health Data Economics, on Tuesday, September 23rd from noon to 1 p.m. Eastern, or watch the recording after. All the information is at CIHI.ca. That's CIHI.ca.